Hi guys, Dr. Mandi here at Drummond Chiropractic, and this week we're going to talk about your 13th week of pregnancy. So congratulations, you're officially in your second trimester. So some of the signs and symptoms, again, pretty similar to before, but the big one, which I'm very much looking forward to, is your fatigue should be going down. So if you noticed during your first trimester you were tired or you tired very easily, now your energy should be coming back up. I'm still suffering from a little bit of fatigue, so I'm hoping it starts to pick up. Again, you might be having some heartburn, those normal food cravings, food aversions, which you want to avoid. And again, those veins might be showing up a little bit more, and we talked about this previously. Your veins become more visible because they expand a little bit to give baby more nutrients. So what's happening this week with baby? The placenta is expanding. So what the placenta is doing is it's getting bigger in order to provide our baby with more nutrients. Fingernails and hair are starting to grow. So if you believe that old wives' tales that the more hair the baby has, the more heartburn is, so that could be a cause for the heartburn, but who knows if that's actually true. Another thing, the vocal cords are starting to form. So this is big because when you do finally give birth, you are always listening for that first scream and cry of the baby. So this is when those vocal cords are forming so that they're able to do that. So this week, baby is officially the size of a lemon. So you're noticing that they're getting bigger and bigger in size. They're gonna start doubling here soon. And so baby is gonna grow more and more each week. So if you have any questions about your 13th week or pregnancy in general, give us a call here. Until next time. Hi guys, Dr. Mandi here from Drummond Chiropractic, and this week we're talking about your 14th week of pregnancy. So for a while now, the symptoms have been pretty much similar, but now they're getting ready to change. And the biggest one that I'm looking forward to, and I haven't hit yet, is the decrease in fatigue. So now that you're a little bit into your second trimester, your energy should be finally coming back. Again, your breasts are going to continue to grow. Now for those who have had a lot of morning sickness, vomiting, decrease in appetite for the first trimester, a lot of you will notice that appetite's finally coming back, your nausea and vomiting are finally ending, and you're overall going to start to feel better. Another thing that you might notice is some around ligament pain and tightness. So that's kind of right here in the area, a little bit lower, one on each side. I have been having this a little bit on and off, so I have a way to help relax it. And whenever you come in, if you come in and get treated by me, I actually teach you how to release your own ligament, so you can do it whenever you have pain, tightness, or just kind of whatever you want as well. So what's happening with baby this week? A couple big things are happening. Baby can start to use their facial muscles, so they can start to smile, grimace, frown, make a lot of facial expressions, and their hair is also starting to form. So this means their arm hair, leg hair, even the cute hair on top of their head. Now this week, baby is growing even bigger and bigger each week. So now baby is the size of a navel orange, so about this size here. And last week we said that they're about 3/4 of an ounce, and now they're grown up to 2 ounces. So each week now from here on out, they're going to start getting bigger and bigger and increasing in size more drastically. So if you have any questions about this or any questions about how we treat pregnant patients, go ahead and give us a call here at the office. Until next time. Hi guys, Dr. Mandi here from Drummond Chiropractic, and this week we're talking about the 15th week of pregnancy. So with the signs and symptoms, I didn't put any that we've been kind of discussing overall, just because we've already talked about those over and over. But some new ones that you might have this week are a little bit of congestion, kind of some allergies, stuffy noses, kind of stuff like that. It's so common in pregnancy that they actually call it rhinitis of pregnancy. You also might notice some nosebleeds. That's because of increased blood flow that our bodies are pumping out. So it's very common to have a nosebleed at this point in time. Now, what's going on with baby? As you can see, quite a bit is going on with baby this week. Their legs are finally growing longer than their arms, and they can actually start to move their arms and legs, and all their different joints are able to move now. So you can even maybe start to feel some kicking at this point, although it's not common for a couple more weeks. Their taste buds are starting to form, and they can actually hear you talking. So this is a good time to talk to your baby, get to know your baby, sing to them, play the music, whatever you choose to do, they can actually hear you now. Their eyebrows are starting to form. They can sense light, so if you sometimes put like a flashlight or something on their belly, they'll be able to tell. And you can also now tell if they are a boy or a girl. They still don't do this on ultrasounds till a couple more weeks, but all their sexual organs are formed, so they're able to tell the difference. This week, the baby is the size of an apple, which is a little bit smaller than my hand still. and they're weighing about 2.5 ounces. So this is kind of what's going on in your 15th week of pregnancy. For me, myself personally, I have had some congestion, not terribly, but I have noticed my nose is just a little bit stuffy. Luckily, I haven't had any nosebleeds yet. So if you have any questions regarding this or anything in your pregnancy, give us a call at the office. Until next time. Hi guys, Dr. Mandi here from Drummond Chiropractic. And this week we're going to talk about the 16th week of pregnancy. So some of the common symptoms, some of your first trimester symptoms should finally be calming down. What I noticed and what I had hoped is everyone says, once you get your second trimester, they all calm down, which is true, but they don't tell you that it takes a couple weeks into your second trimester to calm down. So from what I've noticed with my current patients, a lot of them say around week 16 is when their nausea, mood swings, all of that finally started to slow down for them. Also now you might be having that lovely pregnancy glow that everybody talks about with your glowing skin. What's going on with baby this week? So their heart is pumping even more blood now. So they're about up to 25 quarts of blood each day that they're pumping throughout their body. Last week their legs were starting to develop a little bit more, and they're just continuing to develop this week. Last week again, their taste buds were forming, but now on top of that, the nerves from their taste buds to their brain are also forming, so soon they'll be able to taste. And also their hair patterns are starting to form. So this week, baby is about the size of an avocado, which is roughly 4.5 inches long, and they're about 3.5 ounces. So compared to last week, they've gained about an ounce and about half an inch. Now going forward, they're going to start doubling in size and getting bigger and bigger each week. So if you have any questions regarding your pregnancy, what's going on with you, what's going on with baby, anything at all, give our office here a call and we're more than happy to answer any questions that you may have, or you can schedule an appointment with us. Until next time. Hi guys, Dr. Mandi here from Drummond Chiropractic, and this week we're going to talk about your 17th week of pregnancy. So some kind of new symptoms that are popping up. You might feel a little unsteady on your feet. As your belly is starting to pop out, your center of gravity is changing, so you might feel a little unsteady until you get used to it. You also might start experiencing some dry eyes as well. So what's going on with baby this week? So baby this week, some kind of important things are happening. One of the big things is their skeleton, which had been soft cartilage before, is now actually turning into bone. So it's starting to harden up a little bit. The umbilical cord that supplies the baby with nourishment, blood supply, it's growing a lot thicker and bigger so that it can supply more to the baby. Their sweat glands are starting to develop, and their pancreas is starting to make insulin as well. So those are both big things as well. Some important things to note with your 17th week of pregnancy. One thing is, this is about when your OB will tell you to stop laying on your back. So we have some big, thick arteries that are going from our heart down to our back, which are going to eventually go down to our legs. And our placenta and our uterus and all of those, as they're growing bigger, when you lie on your back, you're actually going to compress those a little bit. And that's actually where your baby's getting blood and nourishment. So if you lie on your back and compress those, it's actually going to decrease blood to the baby. Another thing that they're going to probably tell you is that you need to move more often. This is just good in general for your body, but you want to make sure that you're not in the same position for too long. So this is really important now that you're going to start to do prenatal yoga. You don't ever want to stay in that same yoga position for too long. So this can decrease your blood pressure, make you a little bit dizzy just staying in that same position and not getting that blood pumping around. So make sure you're moving a lot. Now this week, baby's about the size of a turnip, which is roughly about 5 inches long. And you can tell they gained even more weight, so now they're a whole 5 ounces big. So if you have any questions about this, regarding not laying on your back, anything regarding pregnancy, give our office here a call or schedule an appointment, and we're more than happy to help. Until next time. Hi guys, Dr. Mandi here from Drummond Chiropractic, and this week we're going to talk about the 18th week of pregnancy. So some new signs and symptoms that you might be experiencing. One is going to be increased hunger. So this is one I've actually been kind of noticing myself, especially today. I had like 3 or 4 snacks and I'm still hungry all the time. You also might have some increased cravings. So if you didn't have any before, you might have some now. And you might notice some dizziness. So you might have some dizziness because our body's cardiovascular system is working extra hard right now because we have to provide our baby with so much blood, nutrients, and all of that. So your blood pressure might be a little bit lower because of that, causing some dizziness. All right, and then what's going on with baby this week? So not too much is going on with baby this week either. So their ears are in their final position. So initially when they're on their body, they stick out a little bit more. So they're slowly starting to flatten up against the skull. And also myelin sheaths are starting to cover the nerves. So what this is a protective layer over the nerves to protect it from anything coming in. And also tubes and sacs are forming in the lungs. So with our lungs, it starts as one branch and it kind of keeps branching out to all the different lobes, sections of the lungs. So the tubes and the sacs are the very end of those tubes, so they're starting to form with the baby. And this week, the baby is about the size of a bell pepper, so they're about 5.5 inches long, and they're roughly 6 3/4 of an ounce big. If you have any questions about any of this or anything else regarding your pregnancy, baby, give us a call here. Thank you. Hi guys, Dr. Mandi here from Drummond Chiropractic, and this week we're going to talk about the 19th week of pregnancy. So some new signs and symptoms that you might be experiencing are a little bit of lower belly pain, which is most likely around ligament pain. So this is actually something that we talk about when you come into our office. It's something I'll work on every single time you come in, and it's something I'll actually teach you on how to relax on your own to help kind of calm down this pain, calm down any tightness pulling you're having from this area. Another big thing is you might notice some skin changes. So you might notice your palms are a little more red, some darkening of the skin around your upper lips, cheeks, forehead. The darkening of the skin is actually called the mask of pregnancy. It's so common, and this is because of the extra estrogen that's going through your body. So you might notice a little bit of that, and that's actually very common. So what's going on with baby this week? Their fingerprints are forming more this week, so they're actually having more of that kind of single identity going on in their fingerprints, and they have a sensory explosion going on. So what I mean by this is their brain is starting to connect kind of the nerves and wires going to each of their sensory to the part of the brain. So eventually they'll be able to interpret taste, sound, smell, all of that going on. Their arms and legs are finally in proportion to their body. So initially they were a little bit smaller, but now that they're growing, they're a little bit more in proportion to the body. And their hair is slowly starting to sprout. So obviously, if you know babies, this is different from everyone. Some have no hair, some have a full head of hair. So that kind of varies at this point in time as well. And this week the baby is the size of a tomato, roughly about 6 inches long, and they're weighing about 8.5 ounces. If you have any questions about any of this, specifically the round ligament pain, because like I said, that's something we work on and help teach you how to calm it down and stretch it on your own, give us a call here at the office. If not, until next time, thank you. Hi guys, Dr. Mandi here from Drummond Chiropractic, and this week we're talking about week 20 of pregnancy. So some different signs and symptoms that you might be having this week. You might still be having some cramping. This is just because the baby's growing, uterus is growing, a lot of strain on your belly right now. Now you should slowly start to be gaining weight. So at my OB's office, they said about 1/2 pound to a pound a week is a good weight gain. You might notice some itchy skin as, again, your skin is starting to expand in your stomach and your breasts. Might get a little itchy around there. And you might notice some restless sleep. So I was having issues with this, and I got a pregnancy pillow, which for me is night and day difference. Not so much for my husband because it does take up so much room in our bed, but now I sleep like a baby. What's happening with baby this week? Babies are actually able to start sucking their thumbs this week. You may start to feel kicking. You may have already felt kicking. It might not have come yet. For me, I'm still patiently waiting to feel the baby's kicks. If you are expecting a little baby girl, their uterus has formed this week as well. And in week 20 is typically when you start to find out the gender. So I actually have my ultrasound tomorrow morning, and we're doing a small gender reveal on Saturday. So next week we'll be able to tell you the gender of our baby. And this week, baby is the size of a banana. So they're roughly about 10 inches long and about 10.5 ounces. Now this is the first week that they're not actually measuring baby from head to bottom. So now that baby's expanding, they're actually going to start measuring from head to toes. Because before, they were so compact that they typically just measured from their head to their bottom. So now we're going to do the actually whole head to their feet at the same time. So baby's starting to grow a lot more now. If you have any questions regarding this, anything about pregnancy care, prenatal care, anything that we do in this office, just give our office a call. Until next time. Hi guys, Dr. Mandi here from Drummond Chiropractic, and this week we're going to talk about pregnancy week 21. So one of the signs is varicose veins, which we've kind of touched on before. Our body is producing a lot more blood, so our veins can be a little bit more distinguished and you're able to see them a little bit more, and there's a lot more stress and pressure on them as well. Another feeling that you might have is kind of a discomfort feeling in your belly on your different organs. And that's just mainly because your uterus is growing and baby can put a lot more pressure on those different organs. So it might feel discomfort or a little bit of pain as well. So what's going on with baby this week? So around this time is where you should start feeling kicks. I'm still currently patiently waiting to feel my baby's kicks. I had my ultrasound last week, and my placenta is actually a little thicker in the front, so they said it might be for me a couple more weeks, unfortunately. Your eyebrows on the baby are fully grown in. They're starting to swallow a little bit more, so starting to get that reflex of swallowing, and their sweat glands are starting to develop. Another big thing kind of following last week is if you had your ultrasound last week and you chose to, you know your baby's sex this week. So for us, we found out Saturday that we're having a little girl. My husband's still in a little bit of shock mode on that one because he really thought it was a boy. And then this week, baby is the size of a carrot. So in my opinion, this is a very large carrot, but it's about 10.5 inches long, and your baby's weighing roughly 12.75 of an ounce. So this is kind of what's going on with week 21 of your pregnancy. Again, if you have any questions regarding this, regarding anything with baby, give our office a call. Until next time. Hi guys, Dr. Mandi here from Drummond Chiropractic, and this week we're going to talk about week 22 of pregnancy. So some new signs and symptoms you might be having. Your stretch marks might be starting to show up. So a couple of things you can do for this, and I've actually already started. Every night before bed, I rub coconut oil all over my belly to help prevent stretch marks from coming. You can also use oils like essential oils. There's a lot of different things that you can try. You might notice that your belly is starting to itch as it's starting to expand, and you might also notice some acne starting to pop up, and that's because of increased oil production in our body right now as well. So what's happening with baby this week? So this week, the baby's head is completely covered with fine hair now, and their eyes are fully formed. They're still not opening their eyes, but their eyes are finally formed behind the eyelids. So this week, the baby is the size of a spaghetti squash, which is roughly about 11 inches, and they're weighing somewhere around 15 ounces. So this is kind of what's going on in week 22. If you have any questions about this or any questions in general about pregnancy, labor, anything like that, give our office a call. Hi guys, Dr. Mandi here from Drummond Chiropractic, and this week we're going to talk about week 23 of your pregnancy. So kind of a few new signs and symptoms going on. So one thing you can do if you want to feel baby move a little bit more this week, you can kind of start dancing around. The more active you are, the more active they can be as well. And you also might notice that your ankles are starting to swell. So a little swelling is normal and typical. What you want to look out for is excessive swelling in your ankles, and if you notice a little bit more than normal swelling in the face, lips, around the eyes, any kind of thing like that, you definitely want to let your OB know as soon as possible. These are some signs and symptoms of preeclampsia, so you want to catch this as early as you can. So what's happening with baby this week? So not a lot's going on with baby this week. Last week we talked about how their eyes were fully forming, so now their eyes are actually able to move around. They still don't open their eyes yet, but they're able to at least move their eyeballs around. And they can actually hear loud sounds now. So if you have a dog at home, they'll be able to hear the dogs barking now. So this week, baby is the size of a large mango, which is roughly about 11.5 inches long, and they're finally in the 1 pound range. So they're slowly gaining that weight, and hopefully by the end of the pregnancy, they're an ideal weight. So if you have any questions about this, delivery, labor, childcare, anything like that, give our office a call. Hi guys, Dr. Mandi here from Drummond Chiropractic, and this week we're going to talk about week 24 of pregnancy. So not much has changed as far as mom goes. Some signs and symptoms, again, you might have some swelling in the legs, and this could be as your uterus grows, it's starting to compress the veins in the back of your kind of low back area a little bit more, so that can kind of decrease the flow of blood to and from your legs, so causing a little swelling. And your uterus is also growing above your belly button now, and it's roughly the size of a soccer ball. So you can't really tell because my scrubs are a little bit baggy, but if I pull them tight, you can see I finally do have a little bit of a belly popping out there. So what is happening with baby this week? So this week, baby is starting to work on strengthening their facial muscles by kind of raising their eyebrows. So they're working on strengthening their muscles in their forehead. Their internal ears are reaching their adult size that they'll be for the rest of their lives. And their lungs are going to make surfactant, which is going to help them breathe air outside of the womb. So this week, baby is roughly the size of an ear of corn. So they're about 11.75 of an inch long, and they're roughly about 1.25 pounds. So one thing that you definitely do want to look out from this point forward is signs of preterm labor. So if you're having any of these, definitely call your OB as soon as possible or go to the ER.
So some can be like any unusual discharge that you haven't noticed before, some vaginal bleeding, some kind of intense cramping in the pelvic region, some more pelvic pressure because that can be the sign of baby dropping into the pelvis, and then any sort of leaking fluid that's similar to your water breaking. So any of these signs, either call your OB right away or go to the ER because it could be a sign of preterm labor. So if you have any questions regarding any of this, any questions about prenatal care, give us a call at the office here. Thank you.
Hi guys, Dr. Mandi here from Drummond Chiropractic, and this week we're going to talk about pregnancy in your 25th week. So some new signs and symptoms that have popped up, you might notice a little bit of rib pain. So when I'm talking about rib pain, I'm talking more from the baby actually kicking your rib cage. So sometimes their feet tend to get a little bit high in there and they can kick around and cause some rib pain. Something else you might notice is that you might have a little bit of thicker hair now. So with all these hormones increased in our body, the hair that you would typically shed is now sticking around a little bit longer, so making your hair even thicker. You might also notice a little bit of pale skin going on. So this can be actually a sign of iron deficient anemia. Typically around this time, your OB will prescribe for you to do a little bit more blood work to check and make sure that your iron levels are okay. So what's happening with baby this week? So baby's hair is starting to take on its own color and texture. So that beautiful hair when it's born is starting to get formed this week. Their skin is getting less wrinkly, and this is mainly because they're starting to plump up and gain some more weight. And then their intestines are starting to make kind of wave-like movements, so this will help when they're born with their digestive process. So this week, baby is the size of what we call a rutabaga, which is roughly this length from head to toe. They're about 13.5 inches long and weigh roughly about 1.5 pounds. So this is kind of what's going on with baby this week. Personally, I'm lucky I don't suffer from the rib pain because my baby's not kicking my ribs. Instead, my baby's kicking my bladder. So I have that to deal with kind of all day, every day. She likes to kick around on my bladder. So this is, again, what's going on with baby, what's going on with moms this week. If you have any questions regarding pregnancy, any specific week, how we treat pregnant patients or pediatric patients for that matter, give our office a call here. Thank you. Hi guys, Dr. Mandi here from Drummond Chiropractic, and this week we're going to talk about week 26 of pregnancy. So some new signs and symptoms that might be popping up. You might be starting to experience some back pain or have already had back pain throughout. This is mainly because your center of gravity is starting to shift. So for me, obviously with your stomach, you're gonna bulge forward a little bit. So naturally your body's gonna wanna tilt back to keep your center of gravity a little bit better. You might also notice a little bit more leg cramping, especially at nighttime. This is also when you should start looking for the signs of preeclampsia. Now, preeclampsia is more common the farther you are along, about 36 weeks plus is when it typically comes, but it can happen earlier, so you do want to know the signs and symptoms. So what you want to look out for is a higher blood pressure, swelling around your eyes, an excessive amount of swelling in your hands and feet, and a rapid weight gain. So you should be gaining weight right now anyways. When I talk about rapid, I mean like 5 pounds a week rapid. So if any of these signs and symptoms, definitely give your OB a call as soon as you can. Now what's happening with baby this week? So baby can hear broader ranges of sounds. So whether it's lower sounds, higher pitched sounds, and they can even respond with movement. So sometimes when mom or dad are talking to them, they can respond with a kick now. They're starting to breathe in and out the amniotic fluid, so they're learning how to breathe on their own. And as well as you can start to feel them pick up as well. So this week, baby is about the size of a scallion, which in my opinion, this is a very large scallion, but that's about 14 inches long and they're about 1 3/4 ounce in size. So this is kind of what's going on in week 26. If you have any questions with this or any questions regarding your pregnancy, give us a call here at the office. Hi guys, Dr. Mandi here from Drummond Chiropractic, and this week we're going to talk about week 27 of your pregnancy. So some new signs and symptoms that might be popping up. So now that your baby's large enough, they can start pushing against your stomach, so you might get more of a full feeling all the time, and that's just because the baby's pressure is on the stomach. At this point in time, you also want to avoid lying on your back, mainly because of the decrease in blood pressure, because of your placenta and baby are pushing on some kind of vital arteries and veins. It can decrease your blood pressure, causing you to get a little lightheaded, dizzy, faint, all of that. So as much as you can, avoid lying on your back. So what's happening with baby this week? So baby is actually starting to learn how to sleep and be awake at regular intervals. For myself, I've noticed throughout the day I don't really feel baby moving.
But at night, and even when I wake up in the middle of the night, she's kicking like crazy. So right now her days and nights are mixed up, so hopefully once she's born, that'll fix itself. Another thing they're starting to do is actually finally open and close their eyes in the womb. And some babies who are unfortunately born prematurely and born this early, they might actually have a chance to breathe now, because they might be able to breathe on their own. So this week, baby is the size of a head of cauliflower, which is roughly 14.5 inches, and they're weighing about 2 pounds. So this is officially your last week in your second trimester, and next week will be in our third trimester. So we're getting closer and closer to baby time. So if you have any questions about this, anything pregnancy related, give us a call at the office. Thank you.